Types of disabilities.
ADD and ADHD, which stands for Attention Deficit / Hyperactivity Disorder. This is a neurological condition which can affect attention, impulse control, controlling cognitive tasks, motor activity, and social interactions.
Blindness and low vision. There's 3 different types. First one's totally blind. So they use braille or other non-visual media to get information. Legally blind means their eyesight is worse than 20 to 200 vision, and they can only see at the max 20 degrees at the widest point of vision. And then there's low vision. These people have problems seeing distances and near, and have difficulty seeing some things like handouts or projection objects, and you can use adaptive lighting, print sizes, and in some cases braille, for they can get the information they need.
There's students that have brain injuries, and this can be caused in different ways, such as accidents, insufficient oxygen, stroke, poisoning, infection. It's one of the fastest growing disabilities between the ages of 15 and 28.
And then there's deaf or hard of hearing. There are several degrees of hearing loss. This includes low of hearing, which is hard of hearing, and high hearing loss, which is deaf. Some people will say, will call themselves deaf, or written out with a capital D, because that's how they see themselves. They see themselves as deaf. There are several different ways of communication, which includes reading lips, cued speech, and then signing in English or with ASL. But not all of these people speak, lip read, or sign.
There's also learning disabilities. These are neurological base or inferred with listening, speaking, reading, writing, reasoning, and math skills. These people are average or above average intelligence levels. But because they have problems processing and expressing information, it's harder to see it. And in a lot of cases, environment matters. So some people can do better in some environments than others.
There's also medical disabilities, and the conditions affect respiratory, immunological, which is their immune system, neurological, which is their brain, and circulatory, so their circulatory system. Some can affect more than one, however. There's cancer, chronic fatigue syndrome, epilepsy, seizure disorder, fibromyalgia, lupus, multiple sclerosis or MS, chemical dependency, diabetes, Epstein-Barr virus, HIV and AIDS, multiple chemical sensitivity, and renal disease.
There are also physical disabilities. These can be caused by congenital conditions, accidents, or progressive neuromuscular diseases. This includes spinal cord injury, which in turn can cause paraplegia and quadriplegia, cerebral palsy, spinal bifida, amputation, muscular dystrophy, cardiac conditions, cystic fibrosis, paralysis, polio, or stroke.
There's also psychological conditions. These can affect psychologically and behavior, like anxiety disorder, mood swings, depression, and compressed senses of reality. These behaviors can be consistent or not. There's no reason that they can't be with everyone else, and some will control it with medicine or therapy.
So there's also speech and language disabilities, and some causes are hearing loss, cerebral palsy, learning disabilities, physical conditions, and they could have difficulties with articulation or voice strength.
Thanks for the help of Johns Hopkins University Office of Student Disability Services website.